Good evening, everyone. Thank you so much for joining us tonight. We have Brett Hawes, who will be presenting a wonderful 1-hour presentation in regards to the Digestive Health Practitioner Masterclass. And tonight we are specifically discussing IBS, functional approaches through nutrition and applications with Brett Hawes. Brett is a 2006 IHN graduate, and in 2016, he also became certified in functional medicine through Functional Medicine University in the United States. Brett has helped over 1,000 clients overcome a wide variety of health issues in his 16 years of clinical practice. He runs a busy and successful cloud-based online clinic where his primary focus is on chronic and complex digestive issues, hormone health, and autoimmune disease. He has been a faculty member at IHN for over 14 years, and he now currently teaches the fundamentals of nutrition in IHN's online program. He also teaches the Holistic Health Masterclass in our continuing education program and mentors many IHN graduates as a student clinic advisor. Brett's podcast is also reaches over 1,000 listeners in 57 countries each week. It is ranked in the top 200 alternative health podcasts in the world. Brett is a longtime personal rights and freedoms advocate who believes in individuals having access to natural health products and practices of their choice. He is considered an expert in the field of natural medicine and holistic health. Let's welcome Brett Hawes.
Awesome. Thank you so much for the introduction. And I'm going to share my screen and get going. Okay, so welcome everybody to tonight's webinar. Tonight's webinar is titled Functional Nutrition Approaches for Resolving IBS. Learn how to properly assess and address irritable bowel syndrome using functional nutrition testing, nutrition, and supplementation. Really for tonight's presentation, just in terms of learning objectives, I want to drill down on the 3 or 4 key areas, right? Because IBS presents with a lot of symptoms. There's a lot of underlying causes, but I found that if you can tap into the 3 main ones and sort of start there, and we'll talk about how to break the cycle, that's really where you're going to move the needle with IBS, right? So let's jump right into it. And in terms of an overview, IBS affects 15 to 30% of the population. It is the most common digestive disorder and reason for doctor's visits. It is a functional disorder affecting the large intestine or the colon, but as we're going to discover, it actually has its origins a lot of the time in the small intestine. Okay, so more on that coming up. Also known as spastic colon, gastric colitis, mucus colitis, nervous indigestion, and intestinal neurosis, which is a bit of a crazy name. So diagnosed by symptoms and exclusion. So this is very important. There's a new test on the market now, which is very, very, very new, which is actually the first blood test to diagnose IBS. But most practitioners and doctors are actually diagnosing this by ruling out other things. So ruling out inflammatory bowel diseases like celiac, Crohn's, and colitis. And once those are ruled out, then you'll simply get a diagnosis of IBS. And unfortunately, IBS has actually become a bit of a throwaway diagnosis, right? So if we can't figure out what's going on with you, we simply say, well, you have IBS, and off you go, right? There's no treatment for it. There's 4 main types of IBS. So IBS-C, which is constipation, IBS-D for diarrhea. We have a mixed type, which is IBS-M. And then we have post-infectious IBS, which is often referred to as traveler's diarrhea. So a lot of people who will go on vacation, they'll pick up a parasite or they get sick. And then after that, they present with all of the signs and symptoms of IBS. All right. So we do actually have hard diagnostic criteria here. And I'm not going to get into it here. Suffice to say that when you look at this, the whole idea that IBS is a throwaway diagnosis really doesn't make a lot of sense, because we do actually have hard diagnostic criteria for all of these subtypes, right? Post-infectious is a little different. Again, we rule this out by exclusion, but usually people will know that they went on vacation, they picked something up, and they haven't been the same since. And then we do have a small subset, which I did not address earlier, which is IBS unclassified. Okay, so you present with the symptoms, but you're not sure where you fall into the matrix here. This is a great graphic to look into. What you see on the diagram there is the Bristol stool chart, and you can kind of plot where you are. If you know anything about the Bristol stool chart, it goes from 1 to 7, 1 being very, very hard, lumpy type of stool, and then 6 and 7 being very watery and diarrhea. And, again, that's IBS-C to IBS-D, and then somewhere in between. All right. So the key areas of focus when you're dealing with IBS, whether you suffer from IBS personally or whether you're a clinician or a practitioner trying to help someone, these are the key areas you want to focus on. All right. The first one is small intestinal bacterial overgrowth, or SIBO. A large percentage, and the studies differ, right, from study to study, but at least 55% or more of IBS sufferers also have SIBO. Okay, some studies have actually shown that as high as 75%, even 80%. So this sort of dovetails with something called intestinal methanogen overgrowth, which is really a subset of SIBO. Okay, we'll talk more about that in a minute. Diets, right? So allergy, sensitivity, and most importantly, FODMAPs. Right. So FODMAPs, we're going to talk a lot about that tonight. This is really the thing. And of course, if removal of FODMAPs is not working, you might want to then look into allergies and sensitivities. The last one here, stress and underlying psychological issues. Every single person that has IBS is also going to have a stress factor here, which is going to impact the adrenal glands. And they might be, we'll kind of plot that out in a minute. All right. So those are the 3 areas, right? Because I lump SIBO and IMO together, and then the FODMAPs and the diet, and then the stress, right? So this is what we're going to unpack tonight. And before we move on to that, let's just talk about some of the symptoms here. In my clinic, I actually have long questionnaires, which are about 21 questions. And the 21 questions, I usually, if I suspect that someone has IBS, what I'll do is typically give them that questionnaire. And a lot of the symptoms that you're looking at here are on that questionnaire. And the more sort of boxes they check, I'll go, you know what? I think there's a good chance that you have IBS. And even though we don't have a diagnostic, what we can do is we can proceed with some of the functional lab testing and kind of see where that leads us, right? Again, not trying to diagnose disease. What we're trying to do is we're trying to establish from a metabolic standpoint what exactly is going on in the background. So abdominal pain, cramping. Obviously, we've got constipation in the case of IBS-C. We've got diarrhea in the case of IBS-D. And then one of the hallmark characteristics for a lot of IBS sufferers is this alternating constipation and diarrhea. So they'll be constipated for a few, maybe 3 or 4 days, and then they'll have diarrhea, and then they'll go back to constipation. Gas, bloating, mucus in the stools, varying degrees of anxiety and depression, right? Sometimes mimicking soft bipolar, and immediate type of reactions to FODMAP foods. And we'll talk about that in a minute. So things like onions, garlic, artichoke, and so forth, right? So the more boxes you check here, the more likely it is that you do have IBS, all right? So some of the causes here, again, lots of different causes. Gut-brain dysfunction is huge. Food allergies or sensitivities. FODMAPs is a big one, right? We're going to talk about that tonight. So fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, that's a huge mouthful to simply say that these are fermentable carbohydrates, right? So the bacteria that are causing SIBO, right, that are SIBO, what these will do is they will actually ferment these types of carbohydrates and cause the gas, the pain, the bloating, the diarrhea, etc. Psychological conditions, chronic digestive infections, so SIBO. Sometimes we'll also find co-infections like Candida or SIFO, parasites sometimes as well. And then we can, in very rare instances, have structural abnormalities. Okay, and that's sort of outside the scope of nutrition. You might want to look into someone like an osteopath or myofascial release, someone like that. All right. So in terms of functional lab testing, I'll just briefly say that I'm not gung-ho on lab testing like other practitioners are. I do value symptomology a lot. However, I find with SIBO and with IBS, but SIBO particularly, the relapse rates are so high that doing testing can make a huge difference. So first of all, a comprehensive digestive stool analysis. We can do a hydrogen breath test, which is sort of the gold standard, if you will, for SIBO testing. There is a new device and a platform that has come onto the market recently by a company called FODMAP, known as the Air 2 device. This is a home breath test kit that can measure and test for SIBO, as well as food intolerances. Adrenal stress testing, so looking at cortisol, we'll talk about that. Talk about a lot of these anyway. Food sensitivity testing. I usually don't do food sensitivity testing. My sort of first protocol with IBS is always to remove the FODMAPs and then to sort of see from there, like if they're not getting relief, then we might want to look into some food sensitivity testing, right? But a lot of times the sensitivity itself or the allergy is not going to present with a lot of the symptoms that IBS presents with, right? And then last resort here, which again, I don't often run for IBS, but that could be a thyroid panel. If you have very, very stubborn constipation, particularly, sometimes what you can find is the thyroid is very low, and that can be the root of the constipation, especially if someone is not budging, right? So if they're not responding to the diet, not responding to the antimicrobials and so on, then I want to look into thyroid. So hypo or low thyroid can be a cause of constipation. And of course, hyperthyroid can be a cause of diarrhea, okay? But it's usually the hypo that's the problem. So if we want to break the cycle for IBS, this is really the framework that we need to look at here, right? And there is a way to do this. There is an order to do this. The first thing that we usually want to start with is removing dietary triggers. All right, sorry for the typo there. We, at the same time, want to really dig into stress management. Then work with detoxifying through antimicrobials. Sometimes people need antibiotics. We can then repopulate and then strengthen and fortify digestion and keep on building that, right? But I find that the thing that takes the longest with people is usually that strengthening and fortifying and the stress management, which is really ongoing, all right? So, yeah. So let's talk about the diet, first of all. So 75% of IBS patients show improvement from symptoms when FODMAPs are restricted or removed. Okay, and I say patients because I've lifted that straight out of a study, right? And of course, as we said earlier, FODMAPs are fermentable carbohydrates, right? They're short chain carbs that are poorly absorbed in the small intestine and are prone to absorb water and ferment in the colon. Okay, so anytime you have this fermentation going on, usually bacteria is the thing that is going to be doing the fermentation. 50 to 85% of IBS sufferers have SIBO. Okay, so a low FODMAP diet really is a SIBO diet as well. So when we talk about SIBO a little later, the sort of protocol, if you will, from a dietary standpoint, is a low FODMAP diet, right? So it works well for IBS, it works well for SIBO, and these are really, first protocol frontline therapies that most practitioners in this space are employing. You might have to remove food allergens in addition to the FODMAPs. It starts getting very, very tricky when you go down that road because the diet gets very, very restrictive for a lot of people. The minimum time frame, this is very important here. Minimum time frame to start to see things turn around properly is about 8 to 12 weeks. Okay, and the reason for this is that when you start digging into the literature, you'll find that from a symptom improvement standpoint, you can get symptom improvement in as quickly as 4 weeks, right? Sometimes quicker. But the relapse rates are very, very high with SIBO particularly, and this is why you really want to follow through with the 8 to 12 weeks and beyond. We also want to reintroduce foods as per an elimination diet strategy. So let's say someone is experiencing these improvements. We don't want to just sort of say, okay, great, let's just, throw in all the FODMAP foods here and see how you go. Because if they are still sensitive and they do still have some SIBO kicking around and their digestion is not optimized, they're going to blow up and they might land up back to square one very, very quickly. All right, so introducing things slowly, keeping a food journal is a good way to go. So the main goal here is to avoid high FODMAP foods, okay, plain and simple. All right, so avoiding high FODMAP foods, this starves out the SIBO bacteria and reduces symptoms, right? Very, very straightforward. I want to stress, though, that this is a temporary diet and not a forever diet, because I see a lot of people get stuck on a low FODMAP diet. And the reason why they get stuck is because they don't deal with the bacterial issue and the dysbiosis, right? So anytime they try and open the diet up, the bloating, the gas, etc., starts coming back. Okay, so very, very important. So the highest FODMAP foods, we've got fruits that are very high in fructose, so things like apples, pears, mangoes, cherries, figs, and so forth. We've got fruits that are also high in sorbitol, including apples, blackberries, pears, peaches, and plums. We can have vegetables that are rich in fructans. These include artichoke, big problem for IBS and SIBO, huge, garlic, leek, onion, spring onion. This is the category right here that most people are already well aware of that they respond very poorly to, right? Some of the other ones, not as much. Vegetables that are rich in mannitol, including mushrooms, cauliflower, and snow peas. Grain and cereal foods, particularly rich in fructans, include wholemeal bread, rye bread, wheat pasta, and so forth. And then legumes and pulses that are high in GOS, right? This is a type of prebiotic, a type of fiber, and these are kidney beans, split peas, things like falafels, baked beans, and so forth. All right. So dairy can also be high in lactose, okay? So things like soft cheeses, milk, and yogurt. And then nuts that are high in GOS as well include cashews, pistachios, and then some of the low FODMAP nuts include things like macadamias, peanuts, and pine nuts. I'm going through this a little quickly because all of this stuff is searchable online, right? There's no great secrets here, but I did want to do my due diligence by just running through this. So meat is by default low FODMAP, right? Because it doesn't really have any carbs, right? Aside from a small amount of glycogen. However, when we get marinated meats, when we get processed meats that are served with gravy and sauces, these could definitely include hidden FODMAP ingredients that you might not be aware of. High FODMAP sugars include honey, high fructose corn syrup, and sugar-free confectionery, right? I find that a lot of people also don't respond very well to the sugar alcohols, okay, for whatever reason. So low FODMAP options here include things like dark chocolate, table sugar, maple syrup, and rice malt syrup. All right, to pull that all together, and feel free to take a screenshot if you want, if you're on the webinar. This really is a black and white list here, okay, pretty much of everything I've just covered. Now, there is a gradient when you get into it because the amount does matter, right? So even though you might have a low FODMAP or something that's lower FODMAP, if you eat enough of it, it's going to be enough substrate to actually feed and trigger the bacteria. All right. But nonetheless, just for simplicity's sake, we want to go on a low FODMAP diet. And again, there's plenty of resources out there for you to check out. So when we get into supplements relative to this, and unfortunately, I only have an hour with you tonight. Otherwise, it could, this is a long discussion here. There's many hours to unpack. But some of the key supplements that we could be using here, and I want to just touch on a couple of things here that are a bit more, not controversial, but inconclusive, right? So digestive enzymes are fairly straightforward, right? We can have ones with or without hydrochloric acid. We can have ones that are broad spectrum. Now we actually have supplements that are specifically made for FODMAP foods, so that's something to consider. But I like to use more broad spectrum digestive enzymes because they offer the most support, right? Versus going very, very niche and very narrow and just targeting FODMAP foods or something like that. I don't know. I think that, it might work and it might not work. And, it's just in terms of the logistics of practice that can sometimes cause some problems, right? So with fiber has very, very mixed results according to studies. Sometimes fiber can really, really make a difference for people, and sometimes it can really aggravate things. So when we look at things like psyllium, oat bran, hydrolyzed guar gum is really, really good, right? Very well tolerated, probably one of the best things in terms of outcomes. Resistant starches and flax seeds, these all tend to be fairly well tolerated, again, according to studies. When you look at ones that are very poorly tolerated, when we talk about being poorly tolerated, they also they produce symptoms, right? So they worsen symptoms, they aggravate things. This would be inulin, this would be FOS, so fructo oligosaccharides, GOS, galacto-oligosaccharides, and then wheat bran. Okay, and really what we're looking at, yes, we can talk about food, which we just did, but we're also looking at this from a supplement standpoint, right? Because what's going to happen, especially, if you're presenting with constipation, the first thing you want to do as a nutritionist is go, well, if I give someone fiber, it's going to bulk up the stool and move things along. Well, the wrong type of fiber is going to really aggravate things, right? And on the other end of the spectrum, the person with IBS-D and diarrhea, we know that fiber can actually normalize bowel movements by bulking up the stool. So fiber does have its place, but just know that when you look at the ones that are well tolerated, that's probably where you want to gravitate towards. Okay, so the hydrolyzed guar gum is really, really good. Okay, in my books. Also probiotics. Just a word to the wise, because again, we only have an hour here. Probiotics are a double-edged sword with SIBO. And you might want to take a note on this. Very, very important. If you respond poorly to probiotics, it's a good sign that you are dealing with SIBO. Okay, there's other reasons as well, but relative to what we're talking about tonight, there's a good chance that you have SIBO. And imagine SIBO, or small intestinal bacterial overgrowth, means that you have lots of bacteria in the gut. So throwing more bacteria in there can really be like, throwing fuel on the fire. So usually what we want to do with probiotics, instead of introducing them up front, what we want to do is we want to work through the diet. We want to work through some antimicrobial therapy and then start bringing in the probiotics down the line. Okay. And again, that's just the way I do it. I don't do it like that with every single person, because it's really going to depend on how severe that person is. All right. S. boulardii is there's a lot of studies on this. This is well known in IBS and SIBO circles. S. boulardii modulates the intestinal inflammatory response. Very, very effective in the case of infectious diarrhea. So with IBS-D, with post-infectious IBS, right? So diarrhea, looser stool, S. boulardii is very, very effective. It also helps with other infectious agents as well, like yeast, bacteria, C. diff, and parasites. What it actually does is it prevents them from adhering to the bowel wall, right? So S. boulardii, frontline therapy. Peppermint oil, enteric coated. Again, lots of studies here. It is an antispasmodic. It reduces all IBS symptoms by over 50% in 3/4 of cases, right? So lots of studies on peppermint oil and IBS. Decreased abdominal pain, less bloating, reduced stool frequency, and improved stool consistency, right? Remember, there's a gut-brain component, right? There's a stress component here. So we can do 1 to 2 capsules, 200 milligram capsules, and up to 3 times daily between meals. The last one here is a very novel or miscellaneous type of product. It's called ZenBiome Cope by Microbiome Labs. And this is a specific type of Bifidobacterium longum, plus some B vitamins and herbal extracts. This is what is known as a translational psychobiotic, okay, which is a very long-winded, fancy name. And what this does really is it mediates inflammatory-induced stress and associated mood imbalance. Okay, all that we're saying here, this is a very fascinating bacteria. What it does is it actually alters the gut bacteria, which positively affects mood, which positively affects the gut-brain axis. Right. And in addition to that, it also binds up some of these very pro-inflammatory toxins like LPS. All right. I'm going to leave that there for now. Again, that's a very broad brush that we just covered here with supplements. You really need to pare that down for the individual, depending on what's going on with them. And we're going to expand on this from the supplement side of things as we move forward. So when we're looking at adrenals, right? Adrenals and stress. This is the HPA axis, right? So the hypothalamus pituitary adrenal axis. And basically, you have ACTH and corticotrophic hormone receptors in the gut. Okay, I'm just going to say that again. These are stress receptors, right? So we have stress receptors, stress hormone receptors in the gut. And the gut microbiome is directly involved in HPA axis development. Dysbiosis, right, can create an inflammatory stress response, and low microbial diversity can then weaken the feedback loop. So in short, all that we're saying here is high stress actually alters microbial composition, right? This is absolutely mind-blowing when you dig into this whole thing. And a simple way to put it is this. If your gut senses that you're under stress, right? So you've got all of these neurotransmitters. Let's bring up the next slide. You got all of these neurotransmitters, right? So the neurotransmitters in the gut, the neurotransmitters in the enteric nervous system, and the neurotransmitters produced by the brain and nervous system are all the same thing. And so what happens to the bacteria in the gut is they know through these neurotransmitters and hormones, they go, the host is weak. The host is stressed out. This is a fantastic opportunity for us to take a hold, and that actually drives dysbiosis and bacterial imbalance. And because there's crosstalk, we now have crosstalk between the gut and the brain, between the nervous system and the gut, and so on and so forth, right? So very, very fascinating. And of course, you can imagine here, when you double down with hormone imbalances and other things, this can really, really aggravate the whole situation here. All right, so very, very fascinating. You'll actually see to the right-hand side of my slide here, you'll see that certain neurotransmitters encourage things like biofilm growth, right? Decreased resistance to the host, increased virulence of pathogens, okay, and so on and so forth. So very, very fascinating. Again, long discussions on all of that. But when we talk about adrenals, we typically talk about cortisol, okay? Yes, there's 60 other adrenal hormones, but we focus on cortisol. And the reason why is this is the most important anti-stress hormone. Okay, this is what we test for. This is what we look at. It is a glucocorticoid, meaning gluco meaning glucose, right? So it's a hormone that affects blood sugar balance. It follows a diurnal pattern in that it is high in the morning and then it will drop off as night comes around. The key functions include normalizing blood sugar, which we discussed. It's an anti-inflammatory for acute cases. It is an immune system suppressant, right? Very important there. All right, and we know that when cortisol goes up, we can measure things like secretory IgA, and we can see that SIGA goes down, right? It's a vasoconstriction, so this can increase blood pressure, and of course, we know that it influences mood. So cortisol, therefore, fluctuates in response to three key types of stress: emotional stress, inflammatory stress, and unstable blood sugar. Well, if you think about SIBO and then, double down with co-infections like Candida, like SIFO, right? Sugar, blood sugar problems. Anytime you have adrenal issues, you're going to have blood sugar problems as well. So in order for us to manage stress, right? Yes, we can talk about lifestyle. We can talk about all these techniques, which we're going to cover, but it's very, very important. You'll see infections on this list, dysbiosis, food sensitivities, right? So a lot of people focus on the emotional side of adrenals, when actually, in fact, if you focused on the infections, the food sensitivities, the blood sugar imbalances, that's actually going to make a huge difference to the way people feel. And then by extension, based on what we just covered, that's going to positively affect the dysbiosis and microbial balance. All right. So I'm not going to go through this whole list just in the interest of time, but there's no shortage of causes for adrenal burnout, right? So anger, fatigue, illness, infection, pain. You'll see some things I'll pull out on the list here. Gluten intolerance. That's an interesting one. Poor blood sugar regulation, malabsorption, right? Toxins, excessive exercise and sleep deprivation. All right. So, and the reason why I'm skimming through it is I want to get to the good stuff, right? So when you look at cortisol, this is that diurnal pattern that cortisol follows. And so you can see here in this diagram, right, we've got this waking up period here. So as I'm sleeping at night, yeah, I get to, maybe 4 o'clock, 5 o'clock in the morning, and then my cortisol starts to come up, right? And as I go, I wake up and, a few hours into the day, my cortisol levels are naturally going to come down, 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 and then they're going to be at their lowest when I go to bed. So when we're looking at adrenal stress testing, it's very important to take multiple samples, right? We don't want to just take one sample. And also we don't want to use blood, right? Because blood, I see this all the time, right? People will say, oh, I've had my cortisol checked, and they bring in blood work. And I'm like, what time of day was this taken? They're like, no clue. So you can imagine your blood levels of cortisol can change very, very quickly. And you can imagine a scenario where, maybe you're going to the doctor, you're getting blood work done, and you're scared of a needle. Well, just the whole process of being scared of a needle can cause your cortisol to shoot up. And then we go and test it at, let's say, in the morning when your cortisol is the highest. And what do you know? It's high, right? It's out of range. So this cortisol awakening response here, on a lot of the newer testing, they feature the CAR testing, or cortisol awakening response. I like it. It's a decent indicator of what's happening with your cortisol overnight. Okay. But bottom line here is we want to look at adrenal testing throughout the day and do multiple samples. So when you get into adrenals, again, I have a whole adrenal masterclass as well for if anyone's interested, where we really tease all of this apart. But what you will see here is you've got different stages, right? So we move from normal, where our DHEA and cortisol are kind of fluctuating in between this normal high and normal low. And then as we move into stage 1, 2, 3, and finally failure, we move through what is called the alarm stage in stage 1, which is fight or flight, our resistance or adaptive stage in stage 2, and then onto our exhaustion stage in stage 3, where all of those hormones are low. Now, the reason why I bring that up is you can see the time stage, right? The time of each stage is very, very variable. But more importantly here, okay, what this helps us to do is it helps us to identify cortisol patterns and what stage of adrenal burnout your clients or yourself are actually in. Okay, very, very important. It helps us to tailor individualized adrenal support plans. And so depending on what's going on, we might want to choose stimulating adrenal supplements, or we might want to choose calming adrenal supplements, right? So this whole idea of my favorite adrenal supplement or my favorite product, just because it worked for you, it does not necessarily mean it's going to work for other people, because everyone's pattern is going to look a little bit different, right? Another important reason for testing here, and not just for adrenals, but pretty well for any test, is that it establishes a baseline to monitor and track progress. All right. So if you know what you're starting with, then you can sort of tailor things to the individual. You can work through it over the weeks or months. And then in 6 months' time or a year's time, you can actually retest to see if what you have been doing and what your client or patient have been doing, if it actually has been working. All right. Even though, they might feel different for sure, but it's always good to just assess what's going on there. So from the lifestyle perspective, right, a lot of the lifestyle perspectives here really come down to managing stress and addressing stress, right? So managing stress and anxiety, I can tell you right now that breathing exercises, things like vagus nerve stimulation, those are really my go-tos. Okay, they're my go-tos. They work the best. They're free. They're quick, right? They're easy to do because people can do them at any time of day. If you wanted to get into things like cognitive behavioral therapy, neurofeedback therapy, they're far more expensive. They take longer, right? But basic things like establishing boundaries and learning to say no, right? Avoiding over-exercising and overtraining. And instead of, go, so things like high intensity training or spinning classes or something like that, you might want to consider doing more toning and calming exercise like yoga, Tai Chi, and Qigong, right? And of course, we want to avoid overwork as well. So that's really it from a lifestyle perspective. I know we say that's it, but those are some pretty big changes for someone who's trying to manage the stress and by extension, IBS. So moving into the gut health side of things, of course, we looked at diet. Let's talk a little bit about SIBO here. So SIBO is when abnormally large numbers of common cell bacteria or other organisms are present in the small intestine. Okay, so this is small intestinal bacterial overgrowth, not large intestinal. Bacterial overgrowth leads to faulty digestion and absorption and produces excess quantities of hydrogen sulfide, or methane gas. Okay. The gas is really what's driving a lot of the symptoms. Okay. Key points. The gas is what's driving a lot of the symptoms. And depending on the type of gas is going to depend on the symptoms that you're expressing. So hydrogen and methane are not produced by human cells, but these are the metabolic products of fermentation of carbohydrates of intestinal bacteria. All right. So we actually have, they're called archaea or archaea bacteria. And these are the things that are fermenting the carbohydrates and producing the gas. And as we said earlier, FODMAPs are heavily involved, right? So we already covered that. And symptoms are exactly the same as IBS symptoms that we listed earlier. So some of the indicators of SIBO, and this is a good questionnaire for yourself. So even if you don't want to test or anything like that, you can just ask yourself these questions or ask your client or patient these questions. These are very, very strong indicators here. IBS following a bout of acute GI infection, right? Sounds a lot like post-infectious IBS. A temporary improvement in IBS symptoms after taking antibiotics. What's going on there? You've got all of this bacterial overgrowth. You take the antibiotics and they get rid of the bacteria. The symptoms go away, right? And usually what happens is because people have no clue, they keep on eating the same foods, they go back about their lives, and then they relapse, if you will, right? And that's a classic pattern with SIBO where people will go, yeah, sometimes I feel really good, sometimes I feel bad, right? And they're kind of in this ebb and flow state. A worsening of IBS symptoms from ingesting probiotic supplements, especially those with prebiotics like FOS. So if you're finding that you're really reacting really badly to probiotics and prebiotics, there's a good chance that you have SIBO. Eating more fiber increases constipation and worsens other IBS symptoms. And celiacs following a gluten-free diet experience very minimal improvement in digestive symptoms. Okay. The last one here, development of constipation. So type IBS-C after taking opiates. It's a little bit left field, but nonetheless. Right? So have a look at some of those. And if you check those boxes, you might want to get yourself tested for SIBO. So some of the causes here, poor digestive function. So things like low stomach acid, sluggish gallbladder and pancreas, and reduced enzyme output. IBS alters gut motility. Very important, right? IBS alters gut motility, causing bacteria to stay in the gut instead of being eliminated via the stool. All right. We see this a lot, right? Especially with the methane bacteria. Okay, they drive constipation a lot. Any type of intestinal obstruction can cause SIBO here. Ileocecal valve dysfunction, something called the migrating motor complex, which is really just a process whereby the gut sweeps debris, if you will, down the small intestine and out through the large intestine, right? So when that's sluggish, what happens is that bacteria just doesn't get moved and they build up, and then lo and behold, you develop these symptoms. Things like Crohn's, colitis, and diabetes, right? These can definitely be responsible. Proton pump inhibitors or PPIs and antacids. And how many people out there with things like acid reflux, with indigestion, are getting hooked on antacids and then moving on to H2 blockers and then moving on to PPIs, right? And proton pump inhibitors. And people stay trapped there, and you forget that your stomach acid is there to neutralize pathogens, right? It's there to neutralize bacteria and yeast. So once you've lost that first layer of protection, the floodgates are open, right? The doors are open. Heavy alcohol consumption, no surprises there. And some people do have fructose malabsorption. So when we look at a SIBO breath test, right, it's very, very straightforward. All we're doing is we are drinking a solution of glucose or of lactulose mostly. And then we're seeing if the bacteria are producing these gases, right? And then we're measuring the gas coming out through the lungs. Okay, so that's really all that a breath test is. So when we look at that, breath testing measures the hydrogen and methane gas produced by organisms in the small intestine that has diffused into the blood than the lungs for expiration. Remember, hydrogen and methane are not produced by people, okay, only by bacteria. Then what we do is we take the hydrogen and the methane, and these are graphed over 2 or 3 hours, depending on what test you're doing. And this would be compared to a baseline. Typically, your clients or patients would drink a sugar solution of glucose or lactulose. I prefer lactulose, but nonetheless, glucose works as well after a 1 to 2 day prep diet. So hydrogen is going to produce the diarrhea-like symptoms, the looser stool. Methane and hydrogen sulfide are going to produce constipation. It is very, very common to have a combination of hydrogen and methane, right? Hydrogen sulfide is the sort of new kid on the block. Some of the newer tests are starting to look at that. And of course, some of the stool testing, we can see methane, we can see hydrogen sulfide on there, but it's not actually correct to label someone with SIBO, if you will, if you are doing it through stool testing. So this is what it looks like. Again, I'm not going to spend too much time here because it's a long discussion on how to interpret it, but this is what a test would look like if you've never seen a SIBO test. And you can see we're actually taking breath samples here, right? At 0 minutes, at 20, at 40, 60, 90, and so forth. And then they're plotting the hydrogen levels and the methane levels over time, right? And then according to the baseline, they're going to give you a positive or a negative for either of the gases. Okay. And again, we want to run these types of tests so that we can see exactly what's going on. We can tailor the treatment plan, right? Because I will say this, methane is very, very difficult, right? It's the harder of the three, and there's not a lot of supplements that work very well for it. All right. So this is a company, I've actually done a lot of training with them. So in my digestive health masterclass for practitioners, Food Marble have done a number of trainings for us, and they actually are bringing some more. It's a very, very neat device and technology whereby your clients or patients can actually test at home, which is pretty cool. And so they can test every day if they want. And all you do is you pay one price for the device, which is kind of cool, right? So you don't have to repeat test and repeat or pay for the repeat testing of doing breath tests. All right. So in terms of a protocol for SIBO, there's lots of overlap with an IBS protocol, obviously. So if SIBO is present, we definitely want to look at it from the following perspective. We want to look at diet, right? I'm going to say that my first protocol is usually a low FODMAP diet, but some people have also got very good results with the specific carbohydrate diet, okay? The SIBO food guide, so we can actually look at, there's food guides, there's FODMAP guides out there, but generally a low FODMAP diet is kind of the way I go. Herbal antimicrobials for actually wiping out the different types of SIBO, right? Depending on what gases they're producing. We can also use prescription antibiotics. Again, that's outside of scope for us here as nutritionists. But nonetheless, I find that, people will respond to different aspects of a protocol. And some people just don't respond to herbal antimicrobials, right? So if you've tried that, you might want to speak with the physician who can order antibiotics. Binders are very, very useful, right? So anytime we go and wipe pathogens out, they're going to dump all of their toxins, and those toxins can oftentimes be very, very overwhelming for people. So the binders really help to keep things localized in the gut, and it avoids them from being reabsorbed into the system, right? So when people have things like Herxheimer reactions or detox reactions or die-off reactions, those people will tell you, right? They'll say, oh my gosh, I'm so sensitive to detoxing. Okay, binders are a really, really good thing to bring in there. And of course, you want to double down with some good liver support as well. Prokinetics, pro-kinetic, pro-movement. This is very, very good. It's kind of like we discussed with the peppermint oil. The prokinetics are very good for keeping things moving. And I find that some people, especially very chronic IBS sufferers, people with very severe symptoms, sometimes they actually need to be on prokinetics forever, right? Because they find if they don't go on the prokinetics, the bacteria doesn't go out and they relapse very, very quickly, right? So prokinetics are huge. And we discussed earlier about probiotics as well. Okay, so I don't have anything to add. So with the SIBO protocol, clients or patients will often respond to different aspects of the protocol. And I just want to linger here for a minute, right? Some people are not going to respond to the diet, right? So they're not going to respond to the diet, or they're not going to respond as well as you want. They're not going to respond to the herbals. And truth be told, some people will not respond to the antibiotics either. Okay. So what you'll find is, especially, for me, when I'm working with people, a lot of those people have already, they've tried stuff, right? They've tried it all. They've relapsed. They've gone back out. They've tried different herbs. They've tried antibiotics. And so it gets very challenging to try and figure out exactly what's going to work. In our field, though, right, for us on this call tonight, we've obviously tried diet and we've tried the herbal route. Okay. If that's not working, you definitely want to say, hey, maybe it's time to speak with a practitioner or a doctor and look into antibiotics. Okay. There's different types of antibiotics out there. I won't get into it tonight. Suffice to say that there are about 3 or 4 that work very, very well. The beauty of antibiotics is that they work very quickly. Okay. So what you'll find is, the herbal route can be, at least 4 weeks up to 12. The antibiotics can be 2 weeks. All right. Now, that said, the antibiotics obviously are a lot stronger. And so one has to wonder about what the damage, the collateral damage is going to be to some of the good guys, right? So the good flora. And I find that herbs, they do the same thing, but they're not as strong as the antibiotics. Okay, that's why they take longer. So very important here. My last point is to follow through. Right. So follow through, because SIBO has a very high and very quick relapse rate. Right. So people suffering from SIBO, if you go into any groups out there or you start speaking to people, you'll find that people will get very, very quick symptomatic relief. Right. Very, very quick. I've seen people in my clinic that they will get symptom relief in as little as 3 or 4 days. Right. So 3 or 4 days going on a low FODMAP diet, and they go, wow, everything is looking so much better. My clothes are fitting. I've got less bloating, etc. And then what they do is they go, okay, this is great. Everything's fixed now, and off they go. And even people that are working with practitioners, if you go for a month, if you go for 2 months, and they start to see improvements, and they go, okay, wow, because following the FODMAP diet, it's hard, right? It's a restrictive diet. And they are impatient. All they want to do is just get back out there, get back to a normal life, get back to a normal diet. And unfortunately, a lot of people do that too quickly, right? So very, very important to follow through, because you can literally be back to square one in a matter of 3 weeks. All right. So what I would like to do, and I know that was a lot. And of course, in my digestive health practitioner masterclass, we sort of expand on all of these things. SIBO itself is, it's a huge topic, right? And there's a lot of nuance there. And same thing with some of these other items. What I would like to do just for a few minutes here, if I may, is I will just briefly mention the program, because I know a lot of you are interested in that program. We've got some students here, we've got practitioners, we've got alumni, obviously, as well. So I'll just briefly mention what's happening with the program. This is the program. I mean, not this right here. Suffice to say that the program has really evolved over the years. So I started this program in 2018, I think, 2019, somewhere around there. Yeah. And I started it as a short, like 1-day workshop kind of thing. And it's just like evolved and evolved and evolved into now a fully fledged masterclass that is very robust. We've had about 200 practitioners go through the program now. A lot of the practitioners that have come through the program have actually built full businesses and practices around gut health by using the tools, the protocols, the strategies that I teach them. And not only that, they're actually using the content from the program to front load their marketing. Right. So when they talk about gut health, they're actually finding there's nuggets spread throughout here that a lot of people out there don't know about. And so they're using that in terms of their marketing and their messaging, and of course, attracting people into their practice. And building fully fledged practices. So the program itself, I'm doing this live this year, and then that will be it probably for this year. I'm not going to have any access to it after this. So if you've been sitting on the fence or sort of saying, hey, I'm going to enroll in the summer or next fall, you might want to consider enrolling now for this 8-week program. So the start date is February the 20th, and will be our orientation. And then what we're going to be doing is we're going to have 8 weeks, right? So 8 weeks of releasing a module or modules, right? A group of modules every Tuesday. And then the following Monday, we'll have a Q&A. So you'll have a whole week to review all of the content. There'll be Q&As based on the previous week's work. And of course, as we move through that, it's all going to get compounded, right? I'm going to be in that group for 3 months in total, guiding, mentoring, and moderating the group. So even after the 8 weeks is done, I'm going to be there until the 3-month mark. There's a lot of content in there, right? There's a lot of content in there. We've got guest lectures from biotics research, microbiome labs, Food Marble, Fluids IQ. So the labs, I brought in labs and supplement companies as well. And as I say, I've really worked on this hard over the last over the years to get it to where it is. You will have lifetime access to all of the content, of course, and 25% off a couple of the IHN continuing education courses, right? IHN is also going to issue a certificate of completion for those that are interested in that, especially if you are a clinician. So just be aware. And then I'll just briefly mention there's also a ton of resources here, including a book that I wrote specifically for the program. It took me a few years to put together. That is really the manual, if you will. Protocols and guidelines for all of the common digestive disorders, food lists, meal plans. We go through all the functional lab tests to use. Plus, I'm going to teach you exactly how to interpret those. And then there's some other things here like a therapeutic dosage guide and so on, right? I just don't want to take up your time tonight. So there's a lot of things that are baked into that are sort of off to the side as well. And the goal with the program is, yes, it's gut health, but it's also to make your life easier as a practitioner so that you have these types of things at your fingertips, okay? Now, a lot of people will say to me, oh, what if I'm not able to order labs? Okay, this is important. And remember, we're not ordering labs here to diagnose disease. Okay, I want to just really stress that. I don't diagnose disease. None of us here are diagnosing disease. What we're doing is we're running lab tests to assess metabolic function. That's what we're doing. So it doesn't matter what test you're running. If someone is coming in and they're saying, I have diabetes, for example, well, we want to run a test to figure out why they have diabetes. Okay, we want to figure out why they have gas, bloating, abdominal pain, etc. Right? We want to know why they feel stressed out and burnt out. So certified health professionals will be able to open up a lab account with our lab broker partner. And that is, you'll basically be able to order the tests that are covered in the masterclass. And I've set it all up so that you don't have to pay the $250 fee to sign up with the broker. They've waived that fee for us. So if you're worried about that, you will be able to include that. That's it from my side tonight. I mean, we came in just under an hour, so thank you for sticking with me. And then what I would like to do is take some questions here. And Elizabeth, I think if you wanted to manage the chat box, I see we've got chat box and we also have something in the Q&A. So I'll let you do that if that's good.
Amazing. Well, Brett, thank you so much for that incredible presentation. It was very informative, some incredible tips to look out for, and some great information that I know you delve really deeply into in your masterclass. So thank you so much for that.
Thank you.
Thank you to everyone for joining us tonight. Okay, we will be taking some Q&A. So we have one of the first ones here. So can diet alone starve out SIBO bacteria, or are antimicrobials usually necessary?
I'll say that antimicrobials are usually necessary. All right. And that is going to be quite dependent on the severity of the case. So if you've got someone with a very, very mild case of SIBO and you stick them on a low FODMAP diet, it might work. I'll just tell you in my experience, it doesn't work usually. Okay. Also, I'm dealing with a different sort of class of people who have tried a lot of stuff on their own. So, typically they're looking for something more than that. And so antimicrobials is really what I use. Yeah.
Excellent. Excellent. Perfect. And can you provide some examples of prokinetics?
Yeah, sure. So there are there's a lot of supplements out there. I'll just give you the ones that have the most sort of research on them. One is called Iberogast. Okay, so Iberogast. There's another one called Atrantil. Is another one, Atrantil. They all work on different mechanisms. It gets quite technical and granular when you get into it. And then there's a third one by Pure Encapsulations called Motil Pro. Okay. And when you actually look at them, they're all different, right? So some of them have ginger, some of them have peppermint, some of them have 5-HTP, some of them have all sorts of weird and wonderful things, right? So they work on slightly different mechanisms, but those are the three: Iberogast, Atrantil, and Motil Pro by Pure Encapsulations.
Beautiful. And in regards to poorly responding to probiotics, you mentioned this a few times. Are you looking at worsened symptoms of the diarrhea, constipation? How would somebody know that they're getting a poor response to the probiotics that they've chosen?
Yeah, so that's definitely going to look like that. That's going to look like basically however their IBS is presenting, it's going to make it worse. Right. So if they're experiencing more, gas, bloating, diarrhea, it's going to aggravate that. Okay. And then, of course, if you were more on the constipation side, it would aggravate that too. Now, there are some people who respond negatively to probiotics from a completely different mechanism, which is a histamine type of reaction. Those people are going to have more skin rashes and breakouts and stuff like that. It's going to be more on the skin. We're talking here about the gut side of things, right? So the bloating and what have you. Okay.
All right, perfect. Because fiber causes more constipation for those with IBS and SIBO, does this mean the soluble fiber supplement should not be given to clients with suspected SIBO?
Yeah, and that's a great question. I think, for us as a sort of blanket, we look at fiber as this good thing, right? And I think for the most part, it's great. We all need fiber. But in this case, I actually don't normally use fiber supplements at all with these types of folks, right? And the reason why is, it's sort of like throwing mud at the wall and hoping something's going to work. And in my experience anyway, if you try that too many times, it gets very frustrating for the client, because they start to go, oh man, so now I introduced this fiber and I made it worse. And then, oh, well, I just spent, $60 or worse. If you're doing something like pectin, so they're spending all this money and then it's aggravating things. And then they go, oh, well, so then what? We're going to try a different one. For ourselves, we can do that if we want, but in a clinical setting, it becomes a lot harder. So I find myself using binders more and not as much fiber. And, really, again, that low FODMAP diet works very, very well. So, I'm not too concerned about the fiber. Okay. I will say this, that the time that I'm more inclined to use fiber is for the person that has diarrhea, right? I do find that the fiber works better for the diarrhea because it really helps to, form the stool and sort of slow down the transit time. But for constipation, I find it most of the time it aggravates it. All right.
Excellent. Yeah. Good to know. When you're on an H. pylori parasite die-off and removing biofilm protocol, how can you tell that the parasites have been removed without testing? Whether you're testing urea, breath, or stool?
Yeah, you can't. The symptoms are going to improve. That's one thing. And with parasites, it's that's a whole different conversation, right? So parasites, there's so many different parasites. They can live in different parts of the body. So it's a much larger conversation. But like anything, right? Anytime you have a pathogen or an infection of any kind, typically what's going to happen is you can work off the symptoms first and foremost. And I think what a lot of people kind of forget is that we do have what are called common cells, or we do have what are called opportunistic organisms. So like H. pylori is a great example, right? There's lots of debate about H. pylori out there, where consider that 50% of the global population has H. pylori, but not 50% of the population has stomach ulcers and acid reflux and what have you. So the question is, is it actually a pathogen or is it a common cell? Because once you start getting into that, you then go, well, should it be treated? And there's a lot of doctors out there that as soon as H. pylori, I mean, if that just, if gets flagged on a breath test or anything like that, or on a blood test, they're treating it with triple antibiotics regardless. Okay. And I tend to sort of straddle in the middle, and I like to look at symptoms, right? A lot of practitioners are unfortunately not paying attention to symptoms, and they're treating the lab tests. And, we're here at a holistic nutrition school. I want to just tell you right now that symptomology is super, super important, because if you're just treating the labs and you don't know how the person's feeling or what the symptoms are, you're shooting in the dark a little bit, to be perfectly honest. Okay. So great question. Very loaded question, because there's a lot going on there, but nonetheless. All right.
Yeah, perfect. No, that's fantastic to definitely focus on the symptomatology in combination with the tests. Yeah. So is there a particular binder that works best in a SIBO protocol?
Nothing specifically. I mean, there's a whole bunch of different binders out there. It really depends what you're dealing with. Sometimes as well, I get people with mold, for example, mold toxicity. I get mycotoxins. I get other stuff going on. So I might change what I'm using according to what else is going on. But some of the ones that I typically use, and sometimes in combination, are things like activated charcoal. Fulvic and humic acids work very, very well. I've been using those for years. Things like chlorella works very well as well. And then you can get into things like your bentonite clay, and fiber is a binder too, right? Yeah. So it really depends what you're dealing with.
Oh, fantastic. And how effective is a colonoscopy in diagnosing IBS?
Not very good at all. Right. The colonoscopy, what they're looking for with the colonoscopy, remember, IBS is a functional disorder, right? So if I'm looking at something like celiac disease, for example, or if I'm looking at Crohn's or colitis, there are both genetic markers, and there's also autoimmune markers that we can look for, right? We can actually look with a colonoscopy to see, is there actual inflammation? Is there damage to the lining of the GI tract? And then, are there polyps? So so those are when you look at them, you can actually see what's going on. You can test for it. But IBS, there's no test. There's no genetic factors. There's no inflammatory markers. There's no autoimmune markers. So typically what they're going to do with the colonoscopy is they're going to rule out those other things. And then they're going to say, well, you don't have IBD. You don't have this. You don't have that. We don't see any adhesions. Therefore, you must have IBS. Okay. For us, I mean, we know like 100%. We know that there are diagnostic criteria, and so there is an actual diagnosis in the medical system. I'm not sure that a lot of doctors are sort of subscribing to that or even know much about it, to be perfectly honest. All right.
Yeah. Are biofilms of concern with SIBO?
They can be, yeah, sure. I mean, biofilms, I think, are biofilms are all over the place. So when you get into biofilms, it's not just about one. There's usually not one type of organism living in a biofilm. So it's usually a sort of a community of different organisms. So different types of bacteria, yeast, viruses, etc. And to be perfectly frank, right? So to be perfectly frank, we actually have no way, even in the functional medicine space and the nutrition space, we don't really have a good way of assessing biofilms. Like, I don't know of any good tests for biofilms, to be honest with you. And yeah, you could get into things like muscle testing and what have you, but I'm talking about a hard, scientific diagnostic. We don't know, because typically biofilms, the whole way that we discovered biofilms is that they grow on like catheters and stuff like that, right? So foreign objects that are in the body, like pins in your shoulder and stuff like that. The biofilms would grow on there, and then they would cause infection on a localized level. And so then when the doctors go in there, they go, oh my gosh, there's bacteria, there's biofilms. But if they're floating around and, if they're in your bloodstream or if they're in your gut, we don't really have a good way of assessing that properly. Okay. We do know of biofilm disruptors and things that can break them down. But it's a bit of some muddy waters there. That's for sure.
Yeah. Okay. And any suggestions or recommendations on supplement brands for hydrolyzed guar gum?
Yeah, there's nothing specific. I think AOR makes a decent one. I don't use a ton of their products, but for sure. I mean, it's something that you can't really go wrong with. it is what it is, right? Once you start getting into combination products and ratios, then, that's a whole different ballgame. All right.
Great. Yeah. And what's the typical length time for a FODMAP diet?
Again, that's going to really depend on the severity of things because, symptoms can improve very, very quickly. I would say this is in my experience, the literature is a little bit all over the place, but I would say about 8 to 12 weeks. Okay. And that's when you follow through with all of this, right? So we're doing the diet, we're following through with antimicrobial therapy, with repopulation therapy, et cetera. Then you'll find that people will not relapse. Okay. But you know what? You can test it out. So usually what I do after like a couple months, once people are going, okay, wow, we're getting traction, I'm feeling good. I'll say, why don't you challenge yourself with a high FODMAP food? And then they'll eat something like, onion or garlic, and they'll go, oh my gosh, I blew up. I'm like, okay, great. Well, we've got a little bit more work to do, right?
Excellent. Yeah. Now you mentioned fiber, but what is your go-to binder in the protocol for SIBO?
Again, as I discussed earlier, I don't really have a go-to. There's a whole bunch of options there, the charcoal, the fulvicumic, and so forth. Yeah.
Excellent. Okay, and we have quite a few questions in regards to your masterclass.
Yeah, sure.
So first of all, how long is each module?
The modules are all a little bit different. So it's not like everything is equally divided. Some modules are a lot quicker. Some modules are very long. For example, the stool testing, we spend a lot of time on stool testing. I'm actually expanding that open. Microbiome labs came in and they've done about 3.5 hours of training for me, which is awesome because they got a really good stool test. So yeah, it's difficult to say. I think in total, what you can expect is about 25 hours of training, give or take. And of course, we're going to break that up as the weeks go by. So you should have no more than about 3 to 4 hours at the most of content to go through for the week. And then we'll discuss that on the Monday. Okay. And of course, you have lifetime access to everything. So I found that for a lot of practitioners, once they work through it the first time, they got to go back. And then there'll be certain areas, it's like a reference guide. It's not just learn something and then off we go, right? Yeah,
absolutely. And how much is the program? Are there tests? And can someone do it as a current IHN student?
Yeah, so all great questions. The program itself is $16.97. So with IHN though, and I'm glad we're not recording because there's different deals, but you guys get a good deal through IHN. So you will actually get $250 off. And we do have a payment plan as well, which is a 3-month payment plan. I believe that is $627 per month. That's the full price. And then you would get the discount on like over and above that. All right. Did someone else have a question that just popped up about that?
Yeah, about tests. Yeah. They want to know, so what tests are included? Does it include the Dutch test?
Yeah. So as far as when I open up the registration page, I've got the full curriculum on there. Okay. So you'll see a link. And the reason why I say that is there's a lot of tests on there. So it's going to take me some time to kind of rattle them all off. I'm just going to divert you there. There's a reason why I created it, right? But there's a combination. I mean, there's different food sensitivity tests that I cover that are available. I talk about adrenal stress testing. So again, if you wanted to, I don't go deep in the masterclass with adrenal stress testing because, it's a little bit out of scope, but I put it in there and expand on it. There's a good section there on stress and the microbiome and the HPA axis. We're like really get into that. But again, if you wanted to order an adrenal stress test, you could order that through our lab broker. You could do the Dutch test if you wanted, sure, right? I don't cover the Dutch test in this because Dutch is a hormone test. All right. So working on a hormone masterclass, but
that's right. And graduates from different programs are interested. We have someone here from CSNN.
Sure.
Graduates from all types of nutrition schools.
Yeah, I mean, look here. I'll say this. I mean, I've had people that are non-practitioners that have come into the program, and they're very well learned and they're very well read. But this is really for practitioners. I mean, that is what the point is here. And the reason why is, it's very detailed. It's taken me 18 years to get here, and I'm trying to sort of distill everything and teach you So as far as the testing goes, as far as understanding things, it gets a bit technical, but nonetheless, we're all professionals here. So I can see and I can tell you from other people going through the program that the general feedback has been really, really good. And it's really helped people to just take their practice to another level, to be honest.
Absolutely. And so the information for Brett's digestive masterclass is on our website, the Institute of Holistic Nutrition.com. And it's under the continuing education link. And you'll see all the modules that are listed there, the price, the registration, which opens on February 1st. Yeah. And then the actual program starts on February 20th. And okay, we'll just take a few more here in regards to content tonight. Can long-term SIBO cause apathy that you know of?
Just say that again, sorry?
Can it cause apathy, having long-term SIBO? So an emotional response.
Yeah, sure. I mean, yeah, I think chronic infections can do that, generally speaking, to be honest. Mm-hmm. I mean, the impact on the adrenals, the impact on leaky gut, then leaky brain, cognition, mood. Yeah, 100%, for sure.
Yeah, excellent. And we have some people from the United States. So is the lab broker application that you mentioned, is that applicable for the U.S. as well?
Correct. They're actually in the U.S. Yeah,
they are in the U.S.
They're in the U.S. Yeah, yeah. We it's very difficult working with labs in Canada, just for a variety of reasons. So I found I've always since I first ever started working with labs, I've always worked with labs in the U.S. And I'll show you exactly how it all works in terms of just getting your account set up. The lab brokers are really, really good. I'll just say that much. Like once you have an account set up, if you have questions, they've got doctors on staff. So even if you need help with interpreting the test down the line, you just call up the doctors and book an appointment with them, and they'll actually help you as well. So it's it's a fairly straightforward process for the most part.
Excellent. And would you recommend CBD products to help with stress reduction, anxiety, insomnia?
Sure. I mean, insomnia, sure. I think, with CBD, it's the same thing. It's the Wild West out there, right? Because, you've got about 86 cannabidiols in the cannabis plant, and then you've got your own endocannabinoid system with about 13 different receptors. So, when we say CBD, it's a very blanket statement. And so I would be looking at what are the cannabidiols in there, what's going on with myself. But, sleep, pain, I think those are the most researched areas. When it comes to stress reduction, I think that lifestyle would have a much bigger impact, to be honest. And I think that there's some nutraceuticals that are much better, to be honest. Okay.
Excellent. Okay, Brett, and we'll just finish off with, you mentioned that you will be doing the masterclass live this year.
Correct. Yeah.
And that'll just be this one time for this year.
I think so at this point. There's some other things that I'm working on this year. So I might do it again with you guys in the fall, but I don't know yet for sure. But point being is that once I've wrapped up the launch for this program right now, like up till February 20th, registration is not going to be open at all, right? So you can't, because I've had it open for years where people can just join whenever they want. And I'm actually closing it, so you will not be able to join after that. Yeah, and I think that I'm always trying out different models and different ways of delivering it for people. And I think that this one here is going to be the best because instead of teaching all the content, I've already taught it all, right? So I'd rather just share that with you. You go through it on your own time, and then let's sit and talk more. Let's have a Q&A about it, and you can ask me questions. I think that's a better use of time. Okay.
Excellent. Well, thank you so much, Brett.
Right. Thank you.
Yeah, that was fantastic. Thank you to everyone who joined us this evening. Please email us at info@instituteofholisticnutrition.com for more information on Brett's masterclass in digestive health. We look forward to seeing all of you. And Brett, what an exceptional evening with you tonight. Thank you so much.
Thank you. All right. Thanks, everyone.